Hello and welcome. My name is Mark Blatstein, the physician founder of Physician Presentence Report Service. Today, I'm going to go through the different medical care levels that are available in the Federal Bureau of Prisons. Healthcare is delivered through four levels. Care level one, which is individuals under 70 years old who are healthy and rarely need to see a doctor and on barely very limited medications. Care level two is the majority of the population. It should function more or less like a general family practitioner's office. You'll have, whether you have diabetes or no matter what illness you may have, anxiety, depression, all these are all controlled with medications, and you're seen not more than quarterly. Care level three. Care level three is one level below hospitalization care. In other words, for care level three, you need the care, but it's not available 24/7, 365. It's not available around the clock. You may need assistance with activities of daily living, in which case there are inmates that are inmate assistant or companions that are there that are assigned to you. If you have cancer that's been in remission less than 1 year, advanced HIV disease, severe mental illness, it's in remission with medication, severe cognitive heart failure, and end-stage liver disease, these are all care level three. And they are, for the most part, either close to a care level four facility or very close to your community hospitals. Care level four, this is 24/7, 365. It's an aging population that, people are living longer and they're being kept in prison longer. Although the crime rates are down, those that are incarcerated are increasing. So if you're not able to, be able to perform activities of daily living, what is that? It's caring for yourself, going to the bathroom, brush your teeth, taking a bowel movement, showering, feeding yourself. If you're not able to do that, then they have inmate companions for you. So it's such as caring for oneself, performing manual tasks, eating, sleeping, walking, standing, sitting, reaching, lifting, bending. It's where you need care 24/7, 365. If you're on cancer active treatment, you're on dialysis. I'll go through this again. They have kidney dialysis. They do not have liver dialysis. You're quadriplegic. You've had a stroke of head or type. You have had a stroke or head injury. Your major surgery. If you've had major surgery, they will keep you in the care level four facility. And then as you're weaned off of pain medicine, do not expect pain medicine when you go back, when you leave a care level four facility. You have acute psychiatric illnesses, which means they cannot put you into general population, high risk pregnancies. And so I'm going to go through the different prisons with you or the locations with you at this time. And I will move my picture. There we go. And let's see. Butner is in North Carolina. This is considered the gold standing in the Federal Bureau of Prisons. They provide psychiatric care, cancer care. You can't see this. Cancer care, all types of medical care, not much in the dialysis. So you can see it's located out north of Raleigh. They have, not only do they have the medical center, but they also have a Butner low, then there's a Butner medium, there's a camp there also. Because you don't want to choose to just go to a federal medical center, because where you may need hospital care on the outside, when you get into a medical center, first of all, you may not get the care anyway. Two, there are staff shortages, which means there's not enough nurses and doctors to go around, so the care may be delayed. You may not be available, or if it's available, if it's with a long wait time. If they have nurses that they're short of, this all allows for it complete. It makes it not a great stay, and it doesn't speak well for the Bureau of Prisons. But there is a staffing shortage throughout the Bureau of Prisons. It's going to roll over into medical care and healthcare. It's a primary referral center for oncology, chemotherapy, radiation, and as I'm saying, cancer, all types of medical problems, dialysis, not much, psychiatric problems. And so they can provide all of this in North Carolina, but you do not want to go to just pick a hospital because you think it's going to be better. They house violent and nonviolent, inmates. So it's not good. Carswell, for women, located in Fort Worth, Texas. They have a medical and psychiatric referral center for female inmates, all specialties. But again, they're specializing in psychiatric and all medical conditions. I'm not sure they have lots of staff, community-based consultants. Another thing to keep in mind is that you may get to go to an outside consultant, and that consultant in a specialty may recommend a certain type of treatment. Once you come back to the prison is not obligated to provide that care to you. All they had to do was send you for the consult. Don't ask me why, but it's up to the prison whether they want to give you that care. So that's pretty crazy in my estimation. Federal Medical Center Devon, make this clear here. Federal Medical Center Devon, Massachusetts, really made a name for itself because they actually established, I don't know, sometime in the last 5 years, 10 years, a dementia wing. And for mental health needs, this was a real win because they had their staff that worked on that wing, they were trained. But a lot has happened since this dementia wing was developed. And that is, we're back to crumbling infrastructure, staffing shortages. And when you have staffing shortages, and this holds true throughout the whole Bureau of Prisons, but here in the healthcare sector, what will happen is that it's called augmentation, which is when if you're short correction staff, they're going to pull from teachers and nurses to go ahead and have them act as correction officers. And so this just increases your delay in getting treatment and care. And there's a whole separate I have a separate section, search for it on my website, called about CTAC, where there was CTAC as a federal detention center, but medical wise, it's just a small window into healthcare in the Federal Bureau of Prisons as a whole. There was noted, in addition to crumbling infrastructure, there was short staff of nurses. Where 50% of the nurses are short. 50% of the one doctor and Devon was one doctor for 900 inmates. And so it's just, you don't want to go there if you don't have to. Fort Worth, also in Texas. It's a medical center there for males, and it also has a jail for the Marshal Service prisoners. This used to be a low. It wasn't always a medical center. This is sometime in the last 10 years, I believe, 76-bed care unit for care level 4 inmates who need 24-hour nursing care. Again, you do not want to go to Fort Worth if you're a male because you think it's a hospital and you're going to get hospital care. Hospital care in the Federal Bureau of Prisons is not like hospital care at home. Lexington, Kentucky. I tried to get this organized. This is a low security male, has all specials of medicine, as I have here in this column, and it's a primary center for leukemia and lymphoma and cancer. Again, though, it's only for low security male inmates. Rochester. The Federal Medical Center is about 80 miles southeast of Minneapolis. It has major medical and major mental health referral center for male inmates. And care and consultation is available also through the famous Mayo Clinic. But I go back to what I said earlier. If you see an outside specialist and they recommend a treatment, the Bureau of Prisons is not obligated. Period. Full stop. The clinical director makes the final opinion, makes the final decision. Primary referral center for end-stage liver disease, although they only have kidney dialysis. No one has liver dialysis. HIV infections, infectious diseases requiring long-term treatment, psychiatric and psychology services, including inpatient psychiatry, as well as forensic studies. And so, while the facility, is good, you may not, you may be careful what you wish for. And also understand that crime nationwide, while it's going down, the number of people incarcerated is increasing, and they're getting older. Springfield, Missouri. Springfield is a transfer station, and it also has a hospital there. It has major medical and psychiatric referral center for inmates, all medical specialties. It's a primary referral center for high security inmates, extensive psychiatric and psychological services, including inpatient forensic, and again, kidney dialysis. But it's high security, will probably wind up in Springfield. You just do not want to go there. I had a conversation with an attorney the other day, and his client probably could go to a care level 2, which is the majority of the population, but he wanted to go to Springfield. And I said, no, you don't want to just go there. And so I'm going to go ahead and shrink this and go back to parts of this particular slide. This is on my website. Medical care is delivered to care levels. Co-payments. How do co-payments work? If you are indigent and have no money, and there's no money in your bank account, or your I forget what's called, True Links, it's on the tip of my tongue. But if you show that it's under $6, you will get all the medications for no charge. If you injure someone in a fight or an altercation, you will be charged the co-payments that go along with treating that person. If you need to see medical, but you don't have an appointment, they're going to charge you. And if you have a big fever, if you have a correction officer, you can only get a referral there either for chronic conditions, which you already have appointments made, or if you have a medical person scheduling the appointment for you. But if medical is not there and it's after hours and you're not feeling well, you could have COVID, you could have any number of medical illnesses that exacerbate themselves while you're in prison. You're going to go ahead and they may make you pay your copay. Formulary and non-formulary. You want to check and make sure that the drugs you're taking, I speak to too many people where the attorneys really haven't checked the drugs that they're taking to make sure they're available. So like every insurance company, they have drugs that they consider are on formulary and they have drugs that are non-formulary. They're both are generic. If they're on formulary and they're in your PSR, pre-sentence report, which means you're prepared when you go to your pre-sentence interview with all your medical files, all your whole medical record, you probably will get the medication, but it's not guaranteed. If in fact your generic medication is on their non-formulary list, you're not going to get it unless your physician that wrote the prescription noted appropriately in your preparation for your pre-sentence interview why all the medications that the BOP offers on the formulary list are not good for you. Then there's just the prescriptions that are just not available. You don't want to learn all about this when you show up day one in prison. You should know this before you even get to your pre-sentence interview. It's crucial. This is a YouTube. You can catch it on the website, which I'll show you again. Physician, prison consultants, I'll show it to you at the very end. But this is a YouTube, and the YouTube, I read this as an article I published on medical care, the pre-sentence interview, and the pre-sentence report. So it's a long YouTube, but it's worthwhile if you have a medical problem. Here, this goes through again a little bit more detail, care levels 1, 2, 3, and 4, and there are medical, and then there are mental health. So if you have a mental health care level that is, let's say, a 3, and a medical care level, which is a 1, you're going to go to a care level 3 institution because the mental health care level always takes precedence. And I can go into that's a longer YouTube. This is another YouTube that you can listen to, but it goes through where you want to prepare for your interview, medications. If you've taken vaccines, if you're someone who doesn't care about COVID, fine. But if you take the normal influenza vaccine, you've had chickenpox, smallpox, all these vaccines, everything, your medical record needs to be complete because we're not going to have a COVID outbreak again, hopefully in my lifetime, but we will have one worldwide again. But you want to make sure that all of your records are nice and clean and organized before you get to your pre-sentence interview. Specifically, you want to have in your preparation for your interview, know your management variables, your public safety factors. You don't want to be considered a kingpin in whatever your crime was. And if you have a job offer for when you get out of prison, if you own a business and the business was not part of your charge, you can work there. Pure and simple. If you have a letter saying that these people are willing to hire you, then it's a great letter. Here, the reason people read the news is because the bad things that happen to people. This individual, I forget the guy's name, but the judge, Roy Dalton, held the Bureau of Prisons in contempt. Bardell is the person's name. Essentially, they weren't treating him. He had cancer. He was left to wallow in his own filth. And by the time they let him out of prison, they took him to Fort Worth Airport or Dallas Fort Worth. They left him on a bench, took the wheelchair that he needed to get around. And if it wasn't for Good Samaritans who helped him get on a plane and get home, he would have just soiled himself and sat there on that bench. And he would not have been allowed to leave prison. And this is not a medical center. It's a low security Seaganville. He would have died there. But he was able to use the administrative remedy process, which is where when you're home, we all call lawyers. In the Federal Bureau of Prisons, you need to go through their administrative remedy process. As you get before you get to your interview, if you have a medical record, you want to make sure that you have all of your information from all of your doctors. Don't wait till the last minute to collect it because medical staffs, hospitals, they're busy. And so you need to have all of that information ready for them, whether it's CT scans, MRIs, PET scans, nuclear tests, If you've had, if in fact you need surgery and you just don't have time to have the procedure done, but all of that pre-admission testing you've had done by your surgeon and other physicians, now your attorney can recommend a federal medical center for you that will do that, where they will do that surgery. And you can go in and the judge will include that in the order. Mind you, the Bureau of Prisons they do not take orders from the court regarding medications or treatment. But if you're not able to do activities of daily living or to get around or to work, but you still have to go to prison and the surgery was going to be done, but there's no time to do it, there are those that have been able to get the surgery done while they're there if they weren't able to have that done at home. Most of us, though, are going to want to have the surgery before we get there. And that is pretty much it. This is the medical care in federal prison. You can go here to pprsus.com. Questions, give me a call, 240-888-777-8. I'm more than willing to, answer your questions. If you want to engage my services ahead of time, it doesn't have to be medical. You can be the healthiest person in the world, but you still want to get the least amount of sentence that you can. But this has been a brief overview. And I title it, Recent Medical Care has been under scrutiny at the Federal Bureau of Prisons for many reasons. I hope you have a good day. I appreciate you taking the time to listen. And thank you. Have a good day and stay safe.